I just was going to comment on watching that video, watching that doctor afterwards, say, he asked him, well, why didn't you advise this? It's been around for 70 years. And he said, now I'm forgetting exactly what he said. We hadn't exhausted all the medical possibilities. It's like,
Yeah.
wait a minute, you don't even start with the medical possibilities until you exhaust the non-medical ones.
But
That's,
I appreciate his
and
candor.
I
He
wanted to
did
punch him,
allude
but then
to
he got better.
why.
So
Yeah,
Well, and the thing is, at the time when that came out,
doctors don't know.
well, when that came, he was, the lay community thought, wow, here's a doctor who willing to speak the truth. But many of his colleagues he was reviled by many of his colleagues for being so blunt about the influence of drugs. I should, you said, how's Charlie doing? The other thing I didn't mention is he's never had another seizure. And
Oh, that's brilliant.
that's
yeah,
amazing.
and he was on the diet actually for 5 years, because after 2 years, when we tried to wean him off, the seizures returned. So we put him back on the diet for another 2 years and then tried to wean him off, and they came back. But then the third time, when we weaned him off the diet, seizures never came back. So he hasn't had a seizure for 25 years, and he eats whatever he wants, never taken another anti-epileptic drug or anything.
That's amazing. That's great.
is
My
really
daughter
cool.
had one seizure, and it was the scariest thing I've ever seen in my life. She was 1 year old, and I did long-term seizure monitoring in the early '90s as one of my jobs. But I knew to put her on her side and videotape it to see if they can glean anything off that information. But she had a UTI that was massive that explained it. So, but it's amazing that you did your due diligence, you did your research, and was able to help not only him but many other people. And I think this information needs to be readily available as an option. It's not 100%. I wouldn't imagine, but what's the harm in trying that?
The statistically, and actually a much younger version of me said this on that video. After the failure of a first medication, there's a 15% chance the second one will work, and a 1% chance the third one will work. So after now, in a medical consensus agreement written by neurologists and dietitians and scientists who are in that field, they say the ketogenic diet should be strongly recommended after the failure of two medicines.
Yeah.
I personally think
Before that,
that's kind of conservative, and I don't know why it for many.
But at least they're mentioning it as part of the
Yeah.
protocol, which
Now
is
they're
wonderful.
making
that's
it's not
an
yet
improvement.
standard of care. Hopefully, in the near future, it will become standard of care. The big drawback, I think, to lots of people recommending it now is they don't have access to dietitians who are trained in the ketogenic diet who can help people initiate the diet. So rather than refer to a hospital where there is a trained dietitian, they just keep drugging the kid.
And
Yes.
is that what the Charlie Foundation helps patients that are in this predicament to navigate that?
Yeah, we have a website, charliefoundation.org, and among their interviews with lots of scientists and doctors and dietitians who are experts in diet. But about one other thing that we have is a list of all the hospitals around the world who now
That's wonderful resource.
ketogenic diet, and independent dietitians who are skilled, and we vetted this list clearly, who are skilled in the ketogenic diet. So you can contact them, or patient or parents or whatever can contact them directly, and they can help you initiate the diet with yourself or with your kid. Because now it's being shown that it's equally efficacious for adults with epilepsy. The hardest thing for adults is compliance. You know, when you're a little kid like Charlie, he
Your
didn't
mom and dad
we
tell you to.
he just ate whatever we put in front of him. But adults have their own eating preferences,
Yeah.
etc. And so going on a ketogenic diet, which is very restrictive, can be a, you know, put a lot of people off. So, but and that said too, there are tons of recipes available on our website in cookbooks all over the place for ketogenically balanced meals that people can follow and use put themselves on the diet. One of the huge, really in the last couple of years, one of the huge applications is for severe mental disorders like schizophrenia and bipolar, and where people will go on, you know, psychiatrists have no, up until recently, alternative to the drugs, which have horrible side effects, including lots of weight gain and fogginess and whatnot. So that's there's been a real explosion of interest in the diet in the psychiatric community.
All right. And Jeff, I think you're going to put the resources, links to his foundations where folks can get help.
Yeah, I will absolutely, because I think that is the most important thing through this entire discussion is if somebody has their kid right now and they're having seizures, they're on medicines, they can watch this and go, okay, I'll go through the resources. But the biggest issue that I found is that nobody was coming. We were in the hospital with David, and even coming out, nobody was mentioning the ketogenic diet. So this is in recent years, and they all know about it by now, and they're still not offering it as an option. And to get a doctor or a neurologist on board with this, we had to have a little verbal argument with the current one, and then leave and call the insurance company and say, we are without a neurologist right now. And I go to his website and I type in, you know, it has a list of these dietitians to get in contact, and there's one in Cincinnati. And I was trying to bring up to the neurologist, we tried all these drugs and none of them work. They're just making it worse. You know, he's got airway issue. None of these drugs should be on him. They're all respiratory suppressants. Let's try the ketogenic diet. He's fighting it. And so the resources are the most important thing, because then we call the dietitians, and they just went through the hospital and the whole system, coordinated everything, grabbed a neurologist. They set it all up. It's the dietitians that are doing it. Now, the neurologist was on board and supportive, but it's the dietitians that are doing it. They're the ones that are working hard and coordinating everything within the hospital. So we get in there, and they knew he had airway defects, so they called pulmonologists, they had ENT, they had the neurologist, and the dietitians were running this show. And that's what healed. The resources that Jim is offering and making available is what saved my son, because he was dying. His airway was bad, and it was going through. With learning in Malaysia, it gets worse up to the point, and then it peaks, and then it gets better. And it was just getting worse and worse and worse, and his breathing was getting worse and worse and worse. And then, of course, if you're suffocating, you'll have seizures. And so he was having seizures. It was the point where, in a lot of kids that we were partnering up with on Facebook and whatever, in these groups, their kids were dying, and they had the same thing. And we're going, because you're not supposed to give these medicines. It says right on a label, if you speak with any pharmacist, you are not supposed to give these medicines to people with obstructive sleep apnea or laryngomalacia. They will die. And so it was like, how do we get them off this? The neurologist will not do. The pulmonologist was helping, but they can't pull off medicines that the neurologist put on. It's the dietitians. It's the resources that Jim gave, and get in touch with the dietitians at a hospital. And that right there is the solution, because you can always find a different neurologist, but you got to save your kid first, first do no harm, which is kind of the point. So that's a little bit long babbling, but really for me, it was the dietitians is the way that made it happen.
Right. And one of the ways the diet has become more sophisticated is you can use a ketogenic diet. In a sense, even it's easier for tube-fed kids, because you can blend together a ketogenically balanced
Yep.
diet for tube-fed people and just feed it. So in a sense, it's kind of easier to put them on the diet.
It was
And
very
that's
easy,
what
yes.
we innovated.
Yeah, we had
Yeah,
no problems. He had a G-tube.
I'm
Yeah, it
wonder-
was all very easy for us
Right.
once he was on it.
I'm wondering if the people that I know who have suffer from, epilepsy or bipolar or other disorders, they take drugs and they're afraid to get off of them because they don't want to have that happen again. And anyway, but they would, maybe have a seizure once a year. It's not, or even less often than that. So
Right.
if they did the ketogenic diet, how would they even know if it worked? That's
Right.
the problem that they run into.
Yeah, and
Well,
then
once a year is different. There's a lot of seizure
Or a
patients that
bipolar
20,
episode.
30, 40 times a day with medication.
Right. I know, but I'm not, the people I know don't have that. They have it once a year. I know a number of people who have that kind of thing. So
if they're
Yeah,
not
he did
having-
allude to it can help with different bipolar and whatnot, but I'm sure there's a lot of research in that as well. But sorry to interrupt, Jim.
Well, I think a lot of, I didn't realize it at the time, but when we started the Charlie Foundation, sort of the subtext is we're all in charge of our own medical destiny and the medical destiny of our kids. So what I would suggest to someone who's having a seizure a year is look into it. And if you don't mind taking whatever the drug is you're on, why go through that, a big lifestyle change if you don't want to? I mean, so there's no one size fits all, I guess. And so it's up to each of us, like I say, to learn the facts. It's interesting when we found the ketogenic diet hiding in plain sight in the medical library in '94, there was no internet.
Yeah.
So you had to go to a library. I don't know sure people know what libraries are anymore, but
I
you had
remember
to go.
libraries.
And now there's lots of information and lots of good information online, so you can educate yourself about what's involved. And if you have questions, find a dietitian and run it by her. I say her because they're all women.
It does seem that way.
You mentioned that taking these drugs sometimes causes weight gain. So I know
Yes.
that can happen. And
Oh, yeah.
I've also heard that the ketogenic diet has been now in the past few years only been promoted as a weight loss.
Well, that's
so
interesting. Actually, what was the guy's name in the '70s? Jeez. It's been known as a weight loss diet for years. And if I could think of the guy's name, you'd know who it is.
A celebrity
this book here.
or a doctor?
Which I started reading a while ago. I don't know if this is one you recommend. Maybe you recommend some others.
There's tons of good stuff. We have a bunch of books that we recommend on our website too. How can I not think? But the ketogenic diet was a weight loss diet, I think, starting in the 1970s. How can I not think of this guy's name? And it was very popular. And even though it was developed in the 1920s, it was developed at the Mayo Clinic for epilepsy. In the 70s, they started to use it for weight loss, and it's very effective because essentially, I mean, I said they don't know the specific, very complicated mechanisms of the diet, but it changes, what the diet does is change your metabolism from burning sugar, glucose for energy, to burning fat for energy. And the byproduct of burning fat for energy is you make ketone bodies. And the ketone bodies have a very positive effect on the brain. And again, depending on this disorder, for any number of reasons. So to that, and the other point that I always make or I try to make when I get on the subject, is they talk about risk benefit in the medical profession. The risk of trying a ketogenic diet, and especially trying a ketogenic diet with the help of a dietitian, is virtually none. And the benefit can be, well, like in Charlie's case, life
Gave him
changing.
his life back. Yeah.
Yeah, and give his life
That's
back.
right.
Yeah, so, and again, I think it's up to each of us to do his homework and figure that out and figure out what's appropriate and what they can handle. There's some doctors, the last remaining myth that comes out of the medical community, back in the day when Charlie was put on the diet, part of the myths, many of them included, like, it'll stunt his growth, it'll cause him to have a heart attack.
None of those things happened.
No, and they don't. And that was literally myth. But the last remaining myth is that it's too difficult. And you hear that all the time. And I always wonder where in medical school they teach a course in what's too difficult for the patient or the parents of a patient to endure. I don't think, I'd like to audit that class. I don't think they teach it. And so it's amazing how many families we'll hear from who'll have like 5 kids and one kid is on the diet, but somehow and the parents are working and yada, yada, and you would think it would be impossible, but they pull it off and the kid gets better. If the kid gets better, it's a huge incentive to keep pulling it off. Mm-hmm. So that's the last remaining myth I'd like to deal with. It should be the patient's decision whether or not therapy is too difficult for him or her or their family.
I think
100%.
By the time a parent has seen 100 seizures a day over a period of days, they will do anything. I know I would. What is the fix? What can we do to stop this? There's got to be a solution. And parents, they will do whatever. I know that's what I was thinking. And do whatever we can to get it to stop. Hey, if you like these kind of conversations and you'd like to see more, click like and subscribe to our channel. And if you're at the computer and you'd like to hear the whole podcast, click right here.